Welcome to the NEI podcast. In today's episode, we're coming to you from the 2023 NEI Congress in Colorado Springs, Colorado. We'll be hearing from one of our incredible speakers in this special extended Q&A episode to give you a chance to get your unanswered questions addressed from selected presentations.
Hello, my name is Dr. Leslie Citrome, and I will be answering your questions about my Congress presentation, There's No Place Like Home, Addressing Agitation in Dementia. So the first question is, what is the best way to discuss the FDA box-bolded warning on antipsychotics to clients and their family regarding early risk of mortality? This is a very important question. There is no doubt in my mind that families will look up the medicines that their loved ones are being prescribed. They'll see that box-bolded warning and have some questions for you. It's very specifically stated that elderly demented patients with psychosis are at increased risk of death, and that no antipsychotic is actually approved for treating elderly demented patients with psychosis. So we need to make a distinction between psychosis and agitation. And I would tell a family member that this medication I'm thinking of prescribing is approved for agitation associated with Alzheimer's disease. And the product label says I can prescribe it for such a purpose as long as they are agitated. If they have psychosis without agitation, well, they wouldn't be a candidate for this medicine. But in the presence of agitation, it doesn't matter if they're psychotic or not, I can still prescribe it. So I need to be very clear on how the FDA approved this medicine and under which circumstances. But I think it is important to talk about this, particularly when patients are pretty savvy or their families are pretty savvy about medicines and they may have heard about this risk of antipsychotics. Ultimately, it is the patient's behavior and problematic behaviors that lead the family members to seek assistance, and they're often quite desperate for something that would work for them. The next question is it safe to start brexpiprazole at 2 milligrams, or do I need to titrate up? Well, actually, the product label specifically instructs us to titrate. 0.5 milligrams a day, then 1 milligram a day, and you reach 2 milligrams a day only at day 15. So it's very important to use that titration schedule because that's how the drug was essentially studied. And that's how to enhance the tolerability of that agent, especially in someone who, maybe is older, frankly, and has a lot of different medicines on board. Now, at day 29, you can go up to 3 milligrams a day. That's perfectly okay for those patients who require that dose. It is important to try, best you can, to get to 2 or 3 milligrams a day, as those were the doses that separated from placebo. The 1 milligram a day dose did not. According to the studies on brexpiprazole, the questioner asks, it appears it took 8 weeks to separate from placebo. Does that mean it takes that long for it to be effective? That's a good question because you'll see on the curves that there is a reduction in agitation, like right away. It's just not different from placebo immediately. So I would say the moment you use an intervention, you would expect some kind of effect, maybe a placebo effect as we call it. The separation from placebo may take some time. You got to remember you are titrating the drug also to get to 2 or 3 milligrams. That takes time, and I'm not surprised that it would take a good trial of 2-3 months before saying something works or not for an individual person. The next question is, can dexmedetomidine be administered IV, and at what level of agitation? So dexmedetomidine has been available intravenously for quite some time. It's an anesthetic agent. I would not use it for agitation. I would recommend its use to be restricted for anesthesia. I talked about dexmedetomidine sublingual film. The actual dose administered is measured in micrograms. So it's really a very low dose of an anesthetic agent, which is used to control agitation. A question I'm often asked is if a patient is agitated to the extent that they require restraints and/or prolonged hospitalization, it's a problem when titration is slow. Is there a recommendation for more rapid titration when necessary? Well, brexpiprazole was tested with that titration schedule in mind. with going from 0.5 milligrams to 2 milligrams by day 15. A more rapid titration was not fully assessed in terms of both efficacy or safety. The next question is, can you speak to late-onset bipolar disorder in the geriatric population as part of the differential diagnosis on agitation? It's unusual for someone to present with bipolar disorder at an older age. Typically, people with bipolar disorder experience mood dysregulation in their late teens or early adulthood. If I see someone who is older, who experiences mania for the first time, I'd wonder about a biological cause for this mania based on something else going on in that individual person. Maybe a comorbidity, a medical comorbidity that I better check up on and try to figure out. The next question is there any evidence for the use of trazodone in agitation? This has been studied in people with dementia, and it looks promising. However, it's not approved for this indication. It's approved for the treatment of depression. We have used low-dose trazodone for sleep, but again, that would be an off-label use. So, although encouraging, it would be actually not something that I would consider first line. The next question is, how can families and caregivers be educated and trained to effectively manage and support individuals with Alzheimer's dementia who experience agitation? I think education goes a long way, and family members need to be familiar with the disorder, understand the disorder, and actually be able to understand what could happen next. There are a number of organizations that can offer such education. Pamphlets are also available, YouTube videos, and so on from the federal government and agencies regarding Alzheimer's dementia and other dementias. I think that could be accessed pretty easily by individuals. There may be a chapter of a national organization available in their community that can also offer some assistance. Well, that's all the time we have. I thank you for your questions, and I hope my answers prove useful to your practice.
Thank you for joining us for another episode of the NEI podcast. Please let us know what you'd like to hear more about by leaving a review. Don't miss another episode. Subscribe today. For more information about NEI and our premier educational content, please visit NEIglobal.com.